A report by the South African Human Rights Commission in the Eastern Cape reveals that 116 children succumbed to severe acute malnutrition between April 2021 and April 2022. This was revealed in the provincial inquiry into child malnutrition and the Right to Food report on Thursday. Research shows that children are malnourished due to poverty. Well, for more on this conversation, we're joined by Eastern Cape DA Social Development Spokesperson, Kobus Botha. Kobus, appreciate your time this evening. Let's start off with the factors that contribute most significantly to child malnutrition crisis in the Eastern Cape.
Hi, Hugo. Good evening, and good evening to your viewers. I think what's important is to first and foremost just set the backdrop, and that is that in the Eastern Cape, our population has increased from 6.5 million to over 7.2 million at the latest census of 2022. So from 2011 to 2022 census, we've nearly got over 1 million additional people in the Eastern Cape. Now, once we break that down, you will also realize that the Eastern Cape is one of the poorest provinces that we have in South Africa. The unemployment rate stands at 39.7%, and youth unemployment between ages 15 to 25 is sitting at 52%. And that gives us a population breakdown of youth from the ages of 16 upwards that are really, really in dire need of employment, and they're struggling to get employment. And it's against this backdrop also, if you look at the GDP that the Eastern Cape contributes to the national economy at 7.9%. So all these statistical information augments and gives us a picture that the Eastern Cape is really not doing well in terms of its economic growth and providing opportunities. As households are really struggling to put nutritious food on the table, and the cost of staple foods and maize and rice just keep on rising and rising. And this has got an impact on, unfortunately and very sadly, on the youngest of our population, and that's the children. It is really sad that the South African Human Rights Commission's report has once again just proven what we as the DA has been trying to tell the governing party for many, many years, that you are not succeeding with your macroeconomic policies, and we are not succeeding in the Eastern Cape to create a conducive environment that grows the economy, that can ensure that the younger population access opportunities. The report also highlights that the Eastern Cape faces an unprecedented and dire situation when it comes to the child stunting. And we're looking at 20%, 27% of the children in the province that are suffering from stunting. And you're quite right with the statistics that you have just mentioned in terms of the children, the figures, 116. But more disturbingly for me is the fact that the ANC government in the Eastern Cape province has really not taken heed to the DA's call to start addressing the cost of living crisis that we are facing. They have gone so far by cutting back on the most basic and short-term intervention of assisting the poorest of the poor and vulnerable by cutting back on their food parcel budget from 6.1 million right down to 5.2 million in the financial year 2023-24. Now, this is very significant because if you look at during the financial years 2021-22, they delivered over 29,000 food parcels. And during 2022-23, food parcels to the poor and vulnerable people of our province were cut right down to 2,294.
What was the justification? Sorry, Kobus, what was the justification for that cut?
Hugo, let me just say the last very interesting point. I'm going to get to your question and answer it. For this year, financial year 2023-24, the ANC government only managed to deliver 929 food parcels so far. This is an indictment on the ANC government that we have currently in South Africa. Now, they obviously are faced with massive cost constraints given the national deficit as announced nationally by the national minister, and obviously the ANC is trying to cut back on financial expenditure, and instead of cutting back on all the luxury costs of government, they are now first cutting back on the most basic social net needs of the people of the Eastern Cape, and that is your short-term relief of food parcels, which is totally unacceptable for us as the Democratic Alliance.
So has there been a needs assessment by the ANC government in the Eastern Cape to establish, obviously, the needs of the people of this province before cutting back on the specific area? Because
sadly, I serve on the Portfolio Committee of Social Development. We are a multi-party committee, and I can assure you that there was no assessment or impact study given to the Portfolio Committee in terms of the reduction of the most basic lifeline for the poorest and vulnerable, and that is your food parcels. There's no report that was tabled in terms of what is the impact. And in a province that is so in dire need of an expanded social net, we are seeing that instead of assisting the poor, the ANC is actually cutting back on the most vulnerable and poor.
Kobus, I want to go back to that statistic around those 116 kids that succumb to malnutrition that we talk about in that report. Is there a link between youth giving birth to some of these young kids and them succumbing to malnutrition, or are the two not related in any way?
No, Hugo, I think you're quite right. Teenage pregnancy is a reality that we have in the Eastern Cape, and child-headed households is a reality. Given various reasons, HIV/AIDS being one of them, the downturn in the economy, the contracting economy. So these youngsters are falling pregnant at an early age, and due to the lack of economic opportunities, they cannot sustain themselves. And also the little ones can't be sustained because they don't have the income. So they depend on either the grandmother or grandfather's old age pension grant, or on a foster care grant or a child grant that they get, which is minimum at this stage. So yes, there's a link, I believe strongly so.
So let's talk about the proposed interventions by the South African Human Rights Commission, such as increasing the child support grant and addressing this crisis. Are you of the same mind? What does the DA think would be the perfect solution for this challenge?
Hugo, the DA has been on the forefront of trying to sensitize and make aware and expose and criticize the governing party regarding the challenges that we are facing in South Africa. In fact, we are the only party that is really campaigning and lobbying and trying to get the ANC to buy into expanding the zero-rated food basket, cutting down the fuel costs and the transport costs of all these foods. So we really have looked, I have read and I've looked at the report of the Human Rights Commission, and in fact many of those recommendations that's in there you will find in the DA's social policy called Building a Resilient Society. And I'm very pleased with those recommendations that's in the report. Hugo?
Now, Kobus, we're a few months shy of 2024, and obviously next year is the elections. Does this offer the DA an opportunity to preach the good news, if you will, of how you can fix some of these challenges that the people in the Eastern Cape are facing at the moment?
Indeed, Hugo, our policy offer to the voters in the Eastern Cape is clear. And that is that we are putting the voters, the poorest of the poor and the vulnerable, in the center of our safety net policy. We also realize that we don't want to create a dependency on state resources. So our policy is quite a comprehensive policy. And that is what we offer. We go out to the various communities, rural communities, urban communities, we've got two metros, Buffalo City Metro and Nelson Mandela Bay Metro, and we go out and we campaign and we present our policy propositions to the voters out there, and we are very confident that we can increase the social safety net and expand it and support the poorest of the poor. But we must also remember that it's a very complex field that we are endeavoring to move into. So a lot of our policy alternatives has been well researched. We have had engagements with civil society experts. So our policy proposition and proposals are grounded in expert advice. We didn't just sit in an office and thumbsuck this out of our own. It's really been well researched. We know where we're going to get the money from. We know what we're going to do with the money and how we're going to expand and ensure that our safety net really pulls people up out of poverty and puts them on a step ladder, a ladder that can access opportunities that will improve their life in the future, Hugo.
Well, Kobus, you'll be delighted to know that I've got a couple of minutes, so it'll be good to hear what some of those policies are. Now, you've mentioned that unemployment stands at about 39.7%, I think you mentioned, and youth unemployment stands at 52% in the Eastern Cape. So let's talk about how you will address those two issues in particular.
I think it's very important that we do understand that there's various ways of addressing this, and we need to become much more creative and innovative, and we need to embrace technology in South Africa, but more specifically in our rural provinces. We must look at how can we harness technology to cut down red tape and to make it easier to do needs assessments of the poor and vulnerable people that needs our assistance. So at a national level, you would have heard our leader, John Steenhuisen, and many of our other colleagues promoting our propositions in terms of the reduction of taxation on the fuel and for the expansion of the zero VAT rated food basket. Now that will assist the poorest of the poor and vulnerable at great length because it makes those food much more cheaper and they can access then very nutritional foods at a much cheaper price. Some of the other propositions that's been put forward on a national level is also to increase the child support grant at the same level of the official food poverty line, Hugo. And this means that the child support grant under the DA government will be increased. I think it's currently 500. It will be going up to 680. And that will also assist and help. We also believe that we should support young mothers with a grant that will assist them to access and buy a nutritional food whilst the child is still growing. And that is also something new that we have. But we need to definitely look at lowering the cost of food. We also need to make sure that there's access to quality basic healthcare services. We need to reduce the teenage pregnancy by providing increased access to sex education. We need to cover, like I've said, the pregnant mothers to also support the child nutrition.
Kobus, looks like we've run short of time, but I think you have made your point, and I do appreciate you making the time this evening. DA's MEC for Social Development, Kobus Botha. Appreciate your time.